Well, welcome back. Giving no-cost medical care to those in need. Well, a clinic is now open at Bledsoe County High School in Pikeville. I'm glad to be joined by Lieutenant Joy Bricker and Lieutenant Logan Landis. Thank you so much, first of all, for being here today.
Yeah, thank you very much for having us both. We're very happy to be here.
And I have to also say thank you so much for your service as well. Let's start by talking about who is putting together this clinic and this no-cost medical clinic, and who's sponsoring this, and how is, the military, how are you all partnering with Bledsoe County for this particular event?
Yes, ma'am. So the event is affiliated with Innovative Readiness Training, which is a beautiful thing. It's a partnership between the local communities that have these needs that can't be met in other ways, and they put in an application to IRT, and then you have the military units that have the required training that they must accomplish just being in the military. We also put in an application, and if there's a match, you have IRT. And for this year, our units have come together to put in Healthy Tennesseans, which is taking place in both Bledsoe and Ray County high schools.
And again, we're looking at these areas, rural areas, where a lot of times there are a number of health care disparities in these communities. So you all go in through IRT, through this program, and you all partner and you open up these no-cost clinics. And tell us a little bit about the services that you provide for people in these communities.
Absolutely. So anyone can come in, so we don't really turn people away, but we have healthcare services, we have optometry services, we also have veterinarian services, so if people have pets that need spayed or neutered, we also offer that as well, and also public health education. I think one of the really nice things that people can expect from this is eyewear fabrication as well. So if they come in for optometry services, they can also get prescription lenses and get those framed.
Wow, and that is
and dental. I'm sorry.
Dental as
yes.
well. That's another big. Those are two really big ones that a lot of times, because people are not able to afford eye care, obviously, when they can't afford medical care. And then the other is dental, which people are in pain for days, months, years sometimes because of dental problems, which can lead to other healthcare issues as well.
Exactly. So they can come in for cleanings as well as other dental services as well.
So tell us a little bit again about the hours, and they just walk in and they don't have to bring any insurance, anything.
Yes, ma'am. So we are currently on day 5 of our clinical days. We are going through June 12th, will be our last day where we're open and offering no-cost care to the local community. And as Lieutenant Landis said, anyone is welcome to come. We've actually already had some patients that drove all the way from Georgia to come. And we've already seen over 900 patients thus far. And our hours during the weekdays are 9 o'clock until 5 p.m. And then on the weekends, we're open from 8 o'clock until 4 p.m. And they show up, they get checked in, and they get to go to all the various places that they need to be seen. And we try and get them through as quick as possible, while of course maintaining safety and giving that patient that time that they get to sit with the provider.
Do you find that you have a lot of people probably waiting outside when you all open your doors ready to come in?
We definitely have a few that are just very excited to receive some health care, and we're excited to open the doors and have them come in.
And one of the things too, when you look at something like this and you think it's something as simple as, that we take for granted, like, putting on a pair of reading glasses if we need them, or getting some prescription glasses, or just getting our teeth cleaned, or whether it's whatever, an extraction. A lot of times like this, like you were saying, these are just kind of some of the basic services that people aren't able to afford, that leads to so many other health problems and emergencies, and creates this huge disparities in these communities like Bledsoe and Ray counties.
Yes, ma'am.
Yeah.
And we are so happy that we get to partner with the civilian community partners, which are Christine Ralph and Jan Frechette, and working with them to have that partnership where the community gets to see the military in a different light, where we do also come and we heal and we serve, and giving back, and also just having that, you can't give without also receiving, and it's very fulfilling and purposeful for all the members. And we also have almost 300 military members at those sites from various branches of the military.
And let me just say, as we are about 2 minutes out, but it really is when you said something that just kind of stood out, when you said they get to see the military in a different light. And a lot of times, you know, when you think of the military, you think of you all engaging in other activities as you all serve and protect our country. But to see you all in this light, serving, like you said, civilians and in a medical capacity, helping others. I think that, again, what that means for Bledsoe County and for all of us.
Yes, ma'am.
Yeah.
What does it mean for you all to be able to show this side and to serve?
I mean, it's an incredible experience. I mean, I enjoy helping people, but I think the most incredible part of this mission is just seeing all the different branches come together. We have the Marines with us, we have the Navy with us, we have U.S. Public Health Services with us, as well as Army and Air Force. And you know, we all serve in different branches, but we all have one goal in mind in this mission. And we all serve different ways, but we're one force. So it's been fantastic.
Well, again, I would like to thank you both so much again for your service in this particular project and for our country as well. And thank you all so much. And you all were telling me that you all are stationed in California, and so we're glad to have you all here in Tennessee and participating in this effort that's so important for people in Bledsoe and Ray counties. Thank you all both so much for being here today.
Thank you, ma'am.
Thank you very much.
For having us.